Dr. Beck, does physical therapy, is there a need for it when a person is already somehow handicapped? Maybe doesn't have a leg, maybe certain body parts just simply don't move. They're beyond it. It's done. There was an accident. It just cannot be done anymore. Would a person, go to a physical therapist there to learn how to cope with walking with one leg, for instance, or something like that?
Yeah, we physical therapy and physical medicine, we really focus and have a great interest in helping people with mobility problems. Basically, people with problems getting up and down out of a chair, getting from a chair to their bed, getting in and out of a car, driving a car. These are all things, again, that affect your mobility and your ability to get around that we can really help with. Amputation is a really good example of that. People, even though they've got a prosthetic leg or a artificial leg, they still have lots of trouble getting around and frequently need a lot of training. Another condition that causes mobility problems is stroke. This is where one side of your body is paralyzed, and people have tremendous problems getting around. And a combination of physical therapy addressing the act of getting up and down and walking, and physical medicine, in which we address problems with spasms in the muscles, pain in the muscles. Both of these work very effectively to help people get up and do what they need to do, particularly with regards to getting around and getting up and down.
I see. Well, it makes, of course, sense. Again, it's a matter of, like everything else a physical therapist treats, not everything else, but lots of you guys are treating, and what I hear from you talking to you, you seem to have an ability to make the right muscle doing the right thing. And, of course, if a person has an amputated leg, he needs some adjustment on the way he operated before, because now one leg needs to do the job of two, and that might not be totally possible, but you need to prepare him for it and strengthen the muscles he now needs to strengthen. And just like with, my wife, she does dancing, ballroom dancing and Argentina tango, and it's quite amazing what ability she has, what she learns there on how to move certain muscles. I don't even know those muscles exist, and she tells me, come on, put it in. And I try to put it in, and nothing is even slightly moving. And because I don't know how to operate that muscle. And what, and the dancers, again, they know that if you don't pull that muscle, if you don't relax that muscle, you won't be able to do X. I would never think of that. And I think that's what you guys really overall do. You know which muscle does what, and which muscle needs to be strengthened. And of course, as a nerve testing person, from your medicine part, you know which muscle has problems in the first place, if it does, and so you can basically, clean out all the cogwheels and make each cogwheel working, so you have a good running watch, I guess.
Yeah, exactly. If you've had a major change in your body, such as through amputation or stroke, you basically have to relearn how to walk and do things. And so, again, it's a very technical, complicated coordination issue to relearn how to do these very simple activities that most of us take for granted. This is something that we really take a strong interest in helping people with.
Right. Well, what you just said, we take it for granted because we walk from childhood a certain way, and now it's ingrained in ourselves. And you know that, for instance, practice doesn't make perfect. Perfect practice makes perfect. You can practice wrong the whole way. You just get goddamn good at doing it wrong, right?
And I see it all the time.
What?
And I see it all the time where people practice the wrong way, and we have to relearn. We reteach them how to do it.
Right. And when we're, adults, that just doesn't come naturally anymore. If we maybe would be born with one leg, what you teach would probably be natural to us. We would probably figure it out when we were children, but we're not. So now we need to tell us somebody, look, there's a muscle there, you never used it, and you better start using it, and here's how to use it.
Yeah, exactly. So we go through a very complicated process of relearning how to use the other tissue that's still healthy or still there. And again, it's very much like relearning how to do it the first time.
Wonderful. Well, I start getting a whole new level of affinity for the work of a physical therapist. And I think it was that last thing you just said about we're getting so used to have it a certain way. And, the picture of my wife knowing how to use muscles I don't even know I have came in. And, her posture is a lot better than mine because she knows those muscles are there. So I should start going, this is wonderful, I like it. And I think people listening to this video should pay lots of attention to it because we operate better and I think we also look better if we use certain muscles. Sluggish looking and all kinds of things. If you do the right thing, we look better, like in the army. Chest out, stomach in, right? I mean, there are certain muscles you need to do to it in order to make that happen, right?
Yeah. You look better and you feel better.
Beautiful. Dr. Beck, it was a pleasure talking to you.
Thank you very much.